Sorry. So yes, on behalf of the Gambia Society of Microbiology, the American Society of Microbiology Young Ambassador Program, and our collaborators, I am delighted to welcome you all to today's edition of the GASOM ASM webinar series. This webinar series was created as a platform to foster scientific dialogue, public health awareness, and capacity building, particularly around infectious diseases that have direct relevance to the Gambia and the wider West African region. Through these conversations, we aim to bridge science, policy, and community awareness, ensuring that emerging and re-emerging health threats are discussed using evidence-based perspectives. Today's webinar is particularly timely. We will be discussing Rift Valley fever, an important zoonotic and vector-borne viral disease, with a focus on recent outbreaks, transmission dynamics, and the critical question of whether Gambians are at risk. As climate variability, ecological change, and human-animal interactions intensify across the region, conversations like this are essential for preparedness, surveillance, and informed public health action. This webinar is organized through a collaborative effort involving the Gambia Society for Microbiology, the ASM Young Ambassador to the Gambia in collaboration with the ASM Young Ambassador to China, and the Antimicrobial Resistance Research Group at Outbreak, and the ASM UTG Student Chapter at the University of the Gambia. We are very grateful for these partnerships, which reflect the importance of cross-institutional and cross-regional collaboration in tackling infectious disease challenges. Now, before we proceed to our main talk, it's my pleasure to introduce today's webinar host who will guide us through this session and formally introduce our guest speaker. Mr. Mohammed Kamara is a PhD candidate in entomology at Virginia Tech, where his research focuses on mosquito species diversity and arbovirus prevalence across different land use habitats in the Gambia. His work seeks to understand how ecological change shapes mosquito community structure and influence the circulation of emerging viruses, an area directly relevant to today's discussion. Mr. Kamara holds a BSc in Public and Environmental Health from the University of the Gambia and an MSc in Medical Entomology from Virginia Tech University in the United States. Prior to his graduate training, he served as a scientific officer in the entomology department at the Medical Research Council, the Gambia, at the London School of Hygiene and Tropical Medicine, where he contributed to several malaria vector studies and co-authored multiple peer-reviewed publications. He is deeply committed to strengthening vector-borne disease surveillance, science communication, and public health capacity in West Africa. My name is Lamarana Jallo. Once again, forgot to mention that the young ambassador to the Gambia. Now, with that said, it is my honor to hand over the floor to Mr. Mohamed Kamara, who will officially host today's session and introduce our distinguished guest speaker. Mr. Mohamed Kamara, over to you.
Thank you so much, Lamarana, for the kind introduction. Once again, I would like to welcome you all to this webinar. As Lamarana mentioned, my name is Mohamed Kamara, and today I will be the moderator for this webinar. It is my pleasure to introduce our guest speaker, Dr. Isidore. Dr. Isidore is a veterinarian from Rwanda. He holds a degree in veterinary medicine from the University of Rwanda. He also holds a master's degree in tropical animal health from the Institute of Tropical Medicine in Belgium. And then he then proceeded for his PhD from Sokoine University of Agriculture in Tanzania. His research focuses on Rift Valley fever, epidemiology, genomics, and vector surveillance. As he has served in key government institutions, including the Ministry of Agriculture and Animal Resources, I also had the opportunity to work with Dr. Isidore at Virginia Tech at the Eastwood Disease Ecology Lab while he was doing his PhD as a visiting scholar. I learned a lot from Dr. Isidore. He is an excellent scientist and a colleague. So for this discussion, it is important because there is a current Rift Valley fever outbreak in neighboring countries, including Mauritania and Senegal. And then it is very relevant to know whether the Gambia is at risk and how important this is to the Gambian. So today, Isidore will be sharing some of the insights of like past exposure, past Rift Valley fever endemics in Rwanda, highlighting some of the key lessons and experience from the regional preparedness, surveillance, and response during that. So before we begin, just a quick note, like the format of the webinar. The session is going to last for like 1 hour, 40 minutes, approximately 40 minutes of presentation and about 20 minutes of question and answer session. So please, if you have any questions while the presentation is going along, so you can type the questions in the chat box. Yeah, at the end of the presentation, we'll address them during the question and answer segment. And then we might open the mic as well for those who might prefer to speak directly. Yeah, but you can put your questions in the chat box as well. So with that, please join me in welcoming Dr. Isidore. Dr. Isidore, the floor is yours. Dr. Isidore?
Can you hear me?
Yes.
Okay. Thank you so much, Kamara, for introduction and compliment. I think now the title is known for the audience, together with my names and my affiliation. So today we're going to discuss on Rift Valley fever, recent outbreaks in Rwanda, as you said, and in the sub-region. And also we evaluate whether the Gambia is at risk given the current situation. As introduction, Rift Valley fever is a mosquito-borne zoonotic hemorrhagic fever, which is of one health importance. It is caused by Rift Valley fever virus, which is a flavivirus. This virus affects ruminant livestock and humans, and it is a three-segmented, single-stranded RNA virus. As you can see, the three segments, the small segment, the medium, and the large segment. In animals, Rift Valley fever causes significant economic losses, namely high rates of livestock abortions, livestock deaths, market disruption, high cost of outbreak response, etc. In humans, although majority of cases result in mild infection, in 2% of cases, they result in severe public health impact, such as illness, including hemorrhagic syndromes, encephalitis, or organ damage, even human death. Humans are infected through contact with infected animals, tissues, or fluids, but also mosquito bites can also transmit the virus to humans. People at high risk are butchers, slaughterhouse workers, herders, and veterinarians who treat the infected animals. RVF was first described in the Rift Valley region in Kenya in 1930. It was in a farm hosting European merino sheep. This indicates the high susceptibility of exotic livestock because these merino sheep were imported from Europe during the colonial period. Currently, RVF is distributed in more than 33 African countries and the Arabian Peninsula, as you can see on the map. The blue color are countries which reported outbreaks. In green, these are countries which reported serological evidence, and in the other color, those are unknown situation. RVF outbreaks are periodic in nature and they occur between 3 and 15 years of intervals. I gave an example of Tanzania. They had 10 outbreaks, which occur between December and June at every occasion. And as you can see, the average interval in Tanzania is around 7 years and a half. So RVF occurs during prolonged rainfalls with extensive flooding and massive mosquito breeding, as you can see on the figure here. So the condition must be extensive flooding during heavy rainfalls, which give opportunity to massive breeding of mosquitoes, mosquitoes, some of them will be infected and will infect the first animals. And the outbreak mosquito vectors will carry the virus to many animals, and finally the virus will spill over to humans. In East Africa, these weather extremes coincide with El Nino Southern Oscillation, where the sea surface temperature increases, resulting in heavy rains on the continental East Africa. As you can see here, the figure indicates rainfall anomalies during the El Nino period with increased rainfall above normal ranges. Mosquitoes are key drivers for Rift Valley fever virus maintenance in the area. The two mechanisms of maintenance in the environment were reported. One is the permanent silent circulation between the mosquitoes. As you can see here, the mosquitoes are involved in the life cycle of the virus. Also, the virus can maintain in the environment through prolonged dormancy in dry resistant mosquito eggs, where the virus resists in the dried mud in the egg, and they wait the next flooding when they hatch and give rise to massive mosquitoes. Several mosquito species are vectors of RVF and vary from region to region. The research has demonstrated that more than 50 mosquito species have been found naturally infected with RVF in the field. Here I give some examples. Like in Kenya, the major vectors are Aedes mosyntoshi and Aedes ocraceus. In Madagascar, Chilex antenatus is the major vector in the field. Egypt, Chilex pipiense and Chilex antenatus. In Senegal, Chilex poecilipes and Mansonia uniformis are the major vectors. In Mauritania, Aedes vexans and Chilex poecilipes are also the major vectors in Mauritania. In Sudan, Anopheles gambiae, Chilex pps complex were reported as the major vectors. In Saudi Arabia, Chilex tritanilencus and Aedes vesicans. So as you can see, the mosquito vector species varies from region to region. That is the importance of conducting research in each country and each region. Since the discovery of RVF virus, it has showed the potential to spread across borders. As you can see on this map, RVF originates from Kenya, and in 1950s, it went south in South Africa. Then in 70s, it went North Africa, in Egypt, and in the 90s, it crossed the Indian Ocean to Madagascar in 90s, In 1980s, it went to West Africa, Mauritania, and Senegal. So it showed high potential to cross borders. In 2000, it invaded the Asian continent in Saudi Arabia and Yemen. And there are still risks to spread to Europe, where antibodies were reported in Turkey wildlife. Movement of infected animals are major drivers of RVF incursion in new areas. Mobility of infected mosquitoes can also, to some extent, contribute to RVF transmission in new areas. Here I gave some documented evidence. For example, the 2000 Saudi Arabia and the Yemen outbreak was found to be caused by importation of small ruminants from East Africa, while the 2008 Madagascar outbreak was likely caused by the importation of livestock from continental Africa. These are some examples, but different evidence have been found where movement of infected animals have resulted in incursion of the virus in different areas across the world. So this table indicates some recent outbreaks. For example, in this year, 2025, we are having large outbreak in Senegal and in Mauritania, where humans, both humans and animals, have been affected. In 2024, last year, was characterized by a few sporadic cases in Uganda and some in Senegal, but in general, there was no alarming situation of Rift Valley fever across Africa. In 2023, we had the sporadic cases in Uganda. In 2022, we had a large outbreak in Rwanda, which also spread to Burundi, but also sporadic cases were reported still in Uganda. 2020, 2021, sporadic cases were reported in Uganda, Kenya, Senegal, and Mauritania. In 2019, still Uganda reported sporadic cases. In 2018, in Rwanda, we had the first large outbreak, but also RVF outbreak was reported in Uganda. And many sporadic cases in Uganda, Tanzania, South Africa, and Mauritania. In 2017, Uganda and Rwanda reported sporadic cases. In 2016, we had a large outbreak in Niger and sporadic cases in Uganda. As you can see in this table, Uganda has been only reporting sporadic cases, but without large outbreak. Maybe this is caused by the specific nature of the ecosystem, which until now is favoring sporadic cases, but we can't say that, we can't confirm that the large outbreak will not occur. As if we consider the nature of RVF when it occurs in an area, it started by sporadic cases, but finally it ends up by producing a large outbreak. Let's say insight about RVF in Rwanda. Rwanda is geographically located in Great Rift Valley fever region. As you can see on this map, this is the one branch of Rift Valley, and this is also the eastern Rift Valley branch crossing Ethiopia and Somalia. RVF is historically endemic in this region. This disease was first confirmed in Rwanda by PCR in 2012, and we had sporadic cases between 2012 and 2017, except 2015, where the sporadic cases were not reported. This is the indigenous cattle breed, which is called Ankole from Rwanda and Uganda region. So the first large outbreak occurred in Rwanda in May 2018. This map indicates the PCR positive cases confirmed during the outbreak. This outbreak started in the eastern part of Rwanda, the eastern province, and it affected 14 out of 30 districts. Human deaths were suspected in that outbreak, but we had several animal abortions and deaths. During this outbreak, the above normal rainfall were recorded, as you can see it on this graph. This is 2018, where we had above normal rainfall, especially in the eastern part of the country, where the index case was reported. So the second large outbreak occurred in Rwanda in March 2022, and went up to December 2022. Also, this outbreak started in the eastern province as the previous outbreak. Instead of affecting the half of the country, this one affected all the districts of the country. And during this outbreak, 22 human deaths were reported and more than 1,200 cattle cases. Here I gave a photo of the drone, which were used in the RVF outbreak to deliver livestock vaccine in different remote areas in the country during the outbreak. Let's see about the molecular epidemiology insight, the origin of the outbreak and how it spread up to Rwanda. It all started with Kenya 2006, 2007, largest outbreak in Kenya. And this outbreak spread to Tanzania in 2007. It also spread to Somalia the same year, 2006, 2007. Also, it went to South Sudan in 2007. But later, antibodies, RVF antibodies were reported in Uganda in 2009, meaning that this outbreak also spread to Uganda. And later, in 2010, in Rwanda, also the first cases of livestock abortions were recorded in Rwanda. And as I said, we had sporadic cases since 2012 up to 2017, and the first outbreak in 2018. But the abortion cases were recorded in 2010, meaning that the Kenya outbreak were still spreading to Uganda and to Rwanda. And later, in 2022, in Burundi, they reported an outbreak. And the molecular evidence indicated that the same virus spread from Rwanda to Burundi. And the cause of the introduction of RVF in Rwanda, according to the molecular epidemiological study conducted, indicated that RVF isolated in Rwanda was closely related to RVF isolated in Uganda, confirming that the disease would have spread from Uganda to Rwanda. When we conducted investigation, we found that there has been increased importation of exotic breeds of cattle between 2006 and 2012, coinciding with the period where the first abortions of RVF was recorded in Rwanda. So this importation was observed as the likely cause of RVF introduction in Rwanda. The RVF virus resulted in Rwanda, in Burundi, were also similar to those resulted in Rwanda, meaning that the virus spread from, likely spread from Rwanda to Burundi. This slide indicates some of the control measures used in Rwanda to control the 2022 RVF outbreak. The objective of the control was to limit the spread and prevent spillover to humans. During this, at the start of the outbreak, there was an outbreak response committees established at the local and central levels under the coordination of the Prime Minister Office, in line with One Health approach. So there was a committee at the central level and the committees at the different local levels. Apart from this, these committees established, also there was enhanced testing. In Rwanda, 6 emergency testing centers were established in the country, and the teams, both veterinarians and the medical teams, worked together in the day and the night shift to test suspected cases. And the testing were being conducted in these 6 emergency testing centers established across the country. Also, there has been mass livestock vaccination. Both all cattle, goats, and sheep were included in the vaccination campaign, and this was conducted using a door-to-door approach or farm-to-farm approach. So we had different teams deployed in different districts to conduct this vaccination. In addition, we conducted systematic animal spraying with insecticide every week for cattle, goats, and sheep, which are susceptible to RVF. Also, there was a restriction of animal movement to prevent further geographical spread of the virus. In addition, there has been control of slaughter practices. Slaughter of animals was initially restricted in the outbreak zone, but later, in order to avoid the shortage of meat, abattoir activities resumed, and also the animals were first tested by PCR before slaughter. So the government resolved to increase testing of the animals in order to avoid the shortage of meat at the market, ensuring that each animal going to the abattoir is tested using PCR. Let's talk about RVF situation in the Gambia. What we know about the Gambia is located in RVF endemic area of the West Africa, as you can see it on the map. In red color, you can see Mauritania and the Senegal. These are the countries which reported RVF outbreak. And as you can see here, at several times, Mauritania reported RVF outbreak since 1987 up to now. The same as Senegal, since 1987 up to now. There are still outbreak in those countries, and the Gambia is surrounded by Senegal, which is an endemic country. So also, as I said previously, some serological evidence have been found in Gambia about RVF antibodies circulating in that country. Historically, RVF evidence have been first confirmed in the Gambia in 2002 and 2003, where 48% of sampled livestock had neutralizing antibodies, with 83% of this had IgM antibodies, indicating a recent or active infection. Recent RVF evidence in the Gambia, livestock seroprevalence, especially IgG antibodies against the RVF, was detected in many regions of the country in 2020, in this year to 2025, indicating potential silent but widespread circulation of the virus. We were also there was reported localized livestock outbreaks detected in the North Bank of region of the country in this year. In Africa during the 2024-2025 year, RVF activity in West and East Africa was low. Only 12 confirmed human cases were reported in total across Mauritania, Kenya, Senegal, and Uganda, with no deaths reported. But in 2025, this year, Senegal entered its worst RVF outbreak in decades, with a wide geographical spread and significant human and livestock impact. Over 550 confirmed human cases and more than 40 deaths were reported in Mauritania and Senegal since September up to now. So why Gambia is at risk? First of all, we can ask ourselves if Gambia is at risk. The answer is yes. Why? Because Senegal and Mauritania currently have large RVF outbreak, and Gambia is located inside the Senegal. The Gambia shares long porous borders with Senegal, with livestock and people moving freely in the country across the borders. Thousands of sheep, goats, and cattle enter the Gambia from Senegal without veterinary inspection or RVF testing. And also there is a presence in the Gambia of several RVF mosquito species known to be RVF vectors in other countries. And this also is an additional risk factor, because if the virus incurs in the Gambia and there are potential major mosquito vectors, so the disease will spread easily in the country. In the Gambia also, there is a limited surveillance and diagnostic capacity. RVF is not routinely screened in humans or animals in Gambia. There are also several unknown febrile illnesses that are not due to malaria and probably due to RVF. There are recent reports of sudden animal deaths and abortions in North Bank of the Gambia, which raise suspicious of RVF in the country. There is also high reliance on animal husbandry, slaughtering, herding, and the handling of raw animal products, which is a risk factor for humans to contract RVF infections. So what should be recommended to Gambia in order to prevent the outbreak in the country? As evidence have been shown about circulation of RVF in the Gambia, and seasonal introduction of the virus are likely through livestock movements. So we recommend that there should be efficient One Health surveillance around molecular, serological, and epidemiological surveys in order to detect the RVF virus circulation in the country and set preventive strategies. Also, we recommend that targeted livestock vaccination and insecticide spraying be envisaged in the country in order to control the outbreak and reduce the RVF impact in the country. Those are some strategies that would be recommended to Gambia in order to prevent the occurrence of an outbreak in the country. So this is the end of my talk, and I thank you for your kind attention. Thank you.
Thank you so much, Isidore, for the wonderful presentation. Before we move to the question and answer section, let me just give a brief highlight of some of the few key points that I took during the presentation, which is like one of them, which is like kind of obvious. Rift Valley fever is a very mosquito-borne zoonotic disease, which affects the health, like livestock, livelihood itself, and then human health. So it's a very important virus to take note of. Another one is outbreaks are closely linked to environmental factors, which is also a very important thing to note while looking for like trying to avoid Rift Valley fever outbreak. So livestock movement, which is very key, especially in the context of the Gambia, where most of the livestock come from neighboring countries like Senegal and Mauritania. So it is very important that Rift Valley fever is it's very important to note that Rift Valley fever is we are at high risk of Rift Valley fever actually. Yeah. So another thing is concerning the porous borders as well. So it is alarming that the Gambia has a very porous border. There are lumos around, like many Gambians will understand lumo. So livestock come from Senegal to Gambia, and then during Tobaski and stuff like that, most of the livestock come from Senegal. People handle raw meat in the Gambia, especially at the abattoirs and things like that. So which is a very important thing to take note of. So before moving to the reading the questions, Dr. Isidore, what do you think Gambians should look for in terms of warning signs just to avoid Rift Valley outbreaks? Like what should we look for as warning signs that Rift Valley fever might be circulating in the Gambia?
Thank you, Kamara. As warning signs, if we take an example of Rwanda, RVF occurred in Rwanda. The first abortion signs were observed in 2010, and RVF later confirmed in 2012. So since 2012, we observed sporadic cases almost every year, except the 2015 until 2017, and in 2018 we had the first outbreak. So I think this situation is almost similar to Gambia, where Gambia already confirmed serological evidence of RVF in the country. That means the virus is in the country and is silently circulating in livestock or in the wildlife, and it is waiting for appropriate condition to produce an outbreak. So the warning signs are those serological evidence already obtained in the Gambia. Another signs are those sporadic cases you are observing in the north bank of the country. Also, the fact that Gambia is closer to shares borders with endemic countries like Senegal. That means livestock movement across the borders are likely introduce the virus from that country. So taking all this together, it means that Gambia is at a high risk of having an outbreak because the virus normally starts when it occurs in the area. It starts by circulating silently for some years, and when the climatic conditions are favorable conditions occur, then the outbreak will occur immediately. So I think those are some of the warning signs that Gambia should watch and prepare accordingly. Thank you.
Thank you so much, Isidore, for that wonderful answer. And then very brief and very detailed, I mean. Yeah, so Lamin Jadama sent a question. I understand maybe probably in one of the slides where you said the vectors differ in different countries, like the main vectors differ in different countries. So he said, what could be responsible for this variation between the different mosquito species as vectors for this virus in different countries?
Could you come again on the question?
Yeah, in one of your slides, you list the vectors in different countries, like showing the main vectors that are responsible for rift valleys in different countries.
Yes.
If you remember that slide. Yes.
Yeah,
So Lamin Jadama mentioned what could be responsible for this variation between different mosquito species as vectors for different countries.
Okay, if I get very well the question, yes, it is true that in each region, in each country, you will find different RVF vector, especially if we talk about the major vectors. So ecologically, we found that in every region, there are different species of mosquitoes, some of which are vectors of RVF. So the first implication is that RVF has the potential to spread across the world because you will find in many countries, they have one or more RVF vectors, potential vectors, or even major vectors. So this gives the possibility of RVF to spread across the world. As I said, even in Europe, they have identified several mosquito species which are major vectors of RVF. So there is a risk for this disease to spread worldwide. I don't know if I answered very well the question. Thank you.
I think you answered the question. Maybe I'll just make a follow-up question. Could there be like maybe an ecological factors that can be maybe the reason why certain vectors are present in this country and not present in another country? Like, can that be a situation why different countries have different Rift Valley fever vectors? Like the ecological conditions that are favorable for example, Kilex antenatus in the Gambia might not be the same in the another country like Uganda. They have a different mosquito species that like different ecological conditions that favors another mosquito species. Can that be the reason why different countries have different main vector for Rift Valley fever?
Yes, I think yes, there are ecological conditions, factors that detect the availability of species in a given region. Some species are native in a given area, like as we know, biological species, like even in plants and in animals, some species are native to some areas, but also we shall also consider the movement, the economic activities or human and human movement, and even good good transportation can also contribute to the spread of some species in regions which were naturally which were naturally endemic of those species. So one factor is ecological systems that favor this species and not the other species, but also the movement of people and goods also contribute to the spread of some mosquito species in new areas. For example, if you, for example, the Aedes, which there is some Aedes species
This percent?
have spread to Europe.
Oh, okay.
Yes, have spread to Europe through transportation of goods.
Oh, agricultures.
Yes, yeah. So
Yeah, it is agriculture.
they can go through the airplanes and jump to Europe. So some mosquitoes go to new areas through transportation of goods. Thank you.
Okay. So to the next question, the person said, could you share, it's from Hussein. Oh, he said, could you share the reference? I think the reference in the introduction of, I think the English is, okay. Could you share the reference who delivered the introduction? Okay, I think it's about one of the map that you used in your introduction. He said, if you can share the reference. I'm not sure which map exactly it is, but he said it's in the introduction.
Okay, the map we are using in the introduction is from CDC website.
Okay, CDC website. Okay.
2018, yes, 2018.
Okay.
About the distribution of RVF.
Okay.
Yes.
Okay, so another question. He said, what was the lineage, the lineage that caused the outbreak in Uganda in 2009? The genetic.
As I said as I showed on the map, the lineage which is circulating in East Africa, the main lineage is the lineage C, which was identified in 2006 Kenya RVF outbreak. This one has widely spread across countries to South Sudan, to Somalia, to Tanzania, to Uganda, even in Rwanda and Burundi. So this is the lineage which is highly spreading these days. And we recommend that research should be conducted to discover which reasons behind this widespread of this lineage C. Thank you.
Okay, thank you so much. So another question is regarding the use of PCR to detect RVF in animal. How likely are you to have the results within 24 hours of sample collection?
To have the results, or to have what?
Regarding the use of PCR to detect RVF in animals, how likely are you to have the results within 24 hours of sample collection?
Okay. If I go back to the slide where I presented the control measures put in place, because during the 2022 outbreak in Rwanda, we increased testing frequency of the animals, especially at the slaughterhouses, because the objective was to have the results in at least in 12 hours, so that the animals are slaughtered and the meat delivered at the market. So during that period, we had automated RNA extraction from the livestock samples. Also, as I said, we also had permanent teams working in shift day and night, so that once the samples are delivered at the laboratory, they were immediately extracted to isolate RNA using automated machines. And then we proceeded to PCR testing. So it was possible to get the results in 12 hours, and the animals could be slaughtered and meat delivered to the market without a delay.
Okay, so this one is saying, were there any irregular rainfall pattern in the past rainy season in Senegal? Any ecological observation which could have acted as an early warning of the outbreak to come?
Come again about the question.
The person said, were there any irregular rainfall pattern in the this past rainy season in Senegal? This past rainy season. So any ecological observation, which could have acted as an early warning of the outbreak to come.
I think the early warning, because RVF nowadays, due to technological advances, it is possible to predict RVF using ecological climate models.
Okay.
So it is possible to predict the high risk areas in the country, and like you can predict even 3 months before the outbreak. You can start predicting that the outbreak would happen when you consider the climatic condition in the country. So in Senegal and Mauritania, it has been reported that they had increased the rainfall this time from before the outbreak, which could serve as a warning sign to predict the occurrence of the outbreak. And it is similar to the situation we are having currently in Rwanda. We are having increased rainfalls, and currently RVF is suspected in the country. Investigations are being conducted in order to confirm the outbreak. But already, because we have increased the rainfalls in these days, we have started suspecting cases in the country. So
okay.
That means rainfalls are a key sign to consider as a warning sign in
okay, we still have a lot of questions, so maybe we can just make the answers very brief. This one said, have vaccination strategy other than ring vaccination been trialed during different outbreaks across the region? If so, how effective have they been? Can I read the question again?
Yes, no, I got the question.
Okay.
I have not investigated whether vaccination is being conducted in Mauritania and Senegal. Or maybe it's something that we can investigate and found.
Okay. So this one said, as Gambia is vulnerable to RVF, what can be done locally to reduce the spread of the disease?
So the first to do is to increase surveillance in line with One Health approach. Veterinarians and public health authority can work together to carry out an efficient One Health surveillance in animals, in humans, and mosquitoes, so that they can early detect circulations and cases of RVF. Also, as we said, the movement of livestock, of infected livestock, contributes greatly to transmission of the disease in the country. So, animals which are crossing the borders normally should be tested for RVF infections. Also, in the case of localized outbreak, I would advise to start targeted livestock vaccination and spraying insecticide on those animals in order to control the mosquitoes and avoid the spread of the virus in widely in the country.
Okay, so this one said from the diagram showing RVF transmission, I couldn't see an arrow pointing from human to human. Does that mean RVF cannot be transmitted by human to human?
Yes, RVF cannot, according to research, RVF cannot transmit from human to human. Human is considered as dead-end host. So always transmission is done via infected animals to humans or infected mosquitoes to humans.
What about from mother to fetus?
Some cases have been, a few cases have been documented about transmission of RVF from mother to fetus. It's not something which has been widely explored, but some findings, especially in Sudan, have revealed about possibility of that transmission. Is something that research has to investigate further.
Okay, so this one said, what are the key things to look out for as clinician in order to, like, as clinician, I think it's in order to suspect Rift Valley fever?
Rift Valley fever in livestock is first characterized by increased abortion cases in the livestock. That is the first sign that you should watch. So after that, you will also see fever cases. Animals will develop fever, and also the small animals, the young animals, especially cattle, goats, sheep, they will start dying in the fields. Also, you will also notice hemorrhagic syndrome in the animals.
So I think this person is referring to human.
For humans?
Yes.
Okay. For humans, normally the signs are more likely, more or less similar to those in animals, because in animals, in humans, also, as I said, majority of cases are only self-limiting febrile illness. Those are mild cases. So the most frequent sign is fever. People, they develop fever, and then in a few cases, like 2%, you can notice hemorrhagic syndromes or inflammation of the eye or encephalitis. Those are some symptoms that you can watch in humans.
Okay. I'm not sure if there's anyone who wants to ask a question from, like, wants to speak. So let me just maybe read the last question here. Last two questions. What are the preventive measures that you would recommend for herdmen or butchers, since most of them are, like, scientifically illiterate?
Okay, the preventive measures for butchers.
Yeah, since most of them
what?
are not scientifically oriented, so what are the recommendations to give them?
Yes, the big challenge we have with RVF control in humans, we still not have the vaccine widely used in humans. So there's still lack of vaccine for humans. So during the outbreak, the recommended prevention. First of all, it is about the government measures to, during the outbreak, the slaughtering is stopped. You stop slaughtering the animals. So to protect the butchers and the slaughterhouse workers. In case slaughtering can be done, then the butchers and the slaughterhouse workers shall wear the personal protective equipment, such as gloves and masks, because RBF can transmit through aerosols from the slaughtered animals. So it's important to wear masks and gloves to protect them from RBF infections.
Yeah, thank you so much, Isidore. We've gone 4 minutes past time. This has actually been a very educative session. Yeah, so we've learned a lot from you regarding Rift Valley fever, what are the conditions that are favorable for Rift Valley fever circulation, what are the conditions that are favorable to encourage an outbreak. So we've really learned a lot from you in this session. So I want to apologize that we could not read some of the questions due to time. Yeah, so is it okay to share maybe your email or LinkedIn profile in case if any of them have a question or if they have concern regarding some of these things to reach out to you?
Yes, I can provide my email.
Okay, yes, maybe we can put that in the chat box.
Yes.
Yeah, so thank you so much. So with that, I will hand over the floor to Lamarana.
Thank you so much, Mohammed. And once again, our sincere appreciation to Dr. Isidore for such an insightful and timely presentation. You will all agree with me that today's discussion has clearly highlighted the importance of surveillance, preparedness, and evidence based communication when addressing vector borne diseases like Rift Valley fever, particularly in our regional context. We also thank all the participants, even though we could not address all of the questions, but your active engagements and thoughtful questions have really uplifted the spirit of the webinar. Your presence reinforces the value of platforms like the GASOM ASM webinar series, which is going to be a regular monthly webinar series henceforth, in strengthening scientific dialogue and public health awareness in the Gambia and beyond. On behalf of the Gambia Society of Microbiology, the ASM Young Ambassador Program, the ASM UTG student chapter at the University of the Gambia, and all our partners, we thank you for joining us today. And we encourage you to stay connected with the GASOM and ASM for upcoming webinar series. Again, I should like to inform our audience that this webinar is recorded and it's going to be uploaded into the YouTube platform of Gambia Society of Microbiology. So you can always access the recorded versions there if anything was to, if you've missed any part of the webinar. With that, we officially bring today's webinar to a close. Thank you all and have a wonderful rest of your day. See you during our next webinar series again. Thank you.
Thank you so much.
Okay, Dr. Isidore has dropped his email on the comment section. If you have any questions that you could not ask on time, you can always reach out to him personally and you could have an extended discussion about whatever questions that you might have. Thank you.
Thank you so much.